Good morning and welcome to Ask Dr. Murphy, This Week in Public Health. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you today?
Doing just great, thanks.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Bair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers any submitted questions and the headlines through today, June 3rd, and we invite any questions or comments down below. Starting today with updates on the Ebola outbreak. Dr. Murphy, can you tell us about the case numbers?
Finally, some good news here. All the systems have been put in place now. It was about a 1 month delay, but everything is finally catching up. And now that they have the appropriate confirmatory tests, the number of cases has dropped way down from over 1,000 cases to maybe to under 500. Maybe what they've confirmed now is 344 cases, including 60 people who've died. They've also been able to set up three different 80-bed treatment units for Ebola. And so they're in place now, and everything is getting under control. So it's late, but all the appropriate steps have taken place, and the interventions have been implemented. And now we're seeing really what's going on. So this is really good news, and it's just basic good public health.
Absolutely. And another aspect that's been a little confusing or controversial is that it seems there could be, for Americans specifically who are exposed, some sort of observational facility being set up in Kenya. Can you explain to us what the situation
Yeah, so
is?
the American government was proposing to set up an observational unit for exposed Americans instead of sending every exposed American, which is mostly healthcare workers. Instead of sending them immediately back to the US, they were going to put them in this observational unit that's going to be set up with all sorts of medical supplies and stuff. Well, there were two big problems with that. One is that a lot of the exposed people wanted to go home. Okay, one thing, and they're not going to be allowed to go home. They're going to have to go to this place. The other thing is, what about everybody else who's exposed? Or what if they show up at this place? They're going to just be turned away. So there's been some back and forth on this in the press. I don't know really where it stands now, but according to Secretary of State Marco Rubio, that it would be possible to transfer a sick patient back to the United States if necessary.
Mhm.
So I really don't know what's happening here, but that is the story. I think for asymptomatic people that are exposed, I think, why don't they just all come home and just go in isolation here? We have the facilities to watch them, probably not contagious. And, I don't understand why they're making such a big deal about this whole thing, and especially the way they're setting it up. But anyway, that is the story as of today.
Yes, and we will keep our eyes on that as it continues to shift and change. But some big important news for our upcoming COVID vaccines. The FDA has selected the targeted strain. Can you tell us about it?
Yeah, so they've selected the most common up and coming variant right now, which is XFG variant strain, and that's been selected. So Moderna and Pfizer will both be developing their vaccines to be due out in September against this circulating variant right now. Novavax, which has now made a deal with Sanofi to distribute the vaccine, they're not as able to switch the technology that fast. And so their vaccine will be coming out against the JN1 vaccine, which is kind of like the last variant that was dominant. So it's an older variant. It's definitely better than nothing. And they're all related. So there is some cross protection. But in my opinion, you want to go after the one that's really circulating now because that's most likely to be the most prevalent one when the respiratory season starts in the fall.
Mhm. So, very good news. Those are the new formulations of the COVID vaccines, like you said, that we should see starting in the fall, September, October, hopefully.
Right.
But we
We do
do
the same
see
thing with the flu vaccine. They select the strain they're going to make the flu vaccine for and so forth. So it's not that not unusual.
precisely. Now, we have some more COVID evidence adding to the existing bodies of work showing that the vaccine can help protect your heart if you're infected from COVID. Can you break down the results?
Yeah, this is a study reported in PLOS One, which is a very reputable journal. We know that COVID itself and even the vaccine can trigger some heart problems. All right. Uh, People with underlying heart disease are even more likely to get it. And so they looked at a database with 478,000 people, and they looked at the vaccinated versus the unvaccinated, and they found this 18% difference. I mean, that's almost like 1 out of 5 or 6 people uh, that get atrial fibrillation. And atrial fibrillation, is not good to have, and you either have to treat that with ablation or some kind of conversion thing. It's not really good to have. And they found that over a 2-year period of time, the unvaccinated people had a 2.18% versus a 1.19% in the vaccinated people. So that's a significant difference. So it doesn't, 1% difference. I mean, is that a big deal? Well, if you look at 478,000 people, it is a big deal. And if you look at the population at large, it's a very big deal. So it just shows you that preventing serious COVID does help in that particular adverse effect from COVID.
Absolutely. Very great news there and a great study. Of course, if you want the sources directly to your inbox, you can sign up for Dr. Murphy's Substack and get that study right to your email. But our
Right. You can
final
look at the
story,
hard data yourself and make up your own mind.
absolutely. And our final story today is a quick check in on the Hantavirus. Any updates there, Dr. Murphy?
Well, another virus that's kind of running its course. We're still with 13 patients infected. All of them had been on that ship. None of the people that have been isolated, none of the 18 people that have been isolated in the Nebraska facility have gotten disease. So that's, the longer we go, the more we get to that 42-day or 48-day, whatever it is, time for the longest incubation. And it's really good news. So it's just the people on that boat that really were at risk. And the people they came in contact with, although some of them got sick, they didn't get sick from hantavirus. So it's very important to make the appropriate diagnosis. And it looks like this thing is working itself out. We're getting really close to the end, I think, of this hantavirus little mini epidemic.
Well, that is fantastic news. And I'd like to thank you, Dr. Murphy, on that note for your time and your expertise this week, bringing us all the most important information.
Well, thank you, Katie. Have a good weekend.
Thank you. And thank you all for joining us for Ask Dr. Murphy this week in public health. We hope to see you back next week. And as always, any questions or comments are welcome down below or at any of our social media linked in the description. Have a lovely weekend.